Well, as we mentioned, the Prime Minister announcing how he plans to create millions more NHS appointments later today in an effort to reduce waiting times. Health and Social Care Minister Karin Smyth joins us now to discuss. A very good morning to you. Thanks for joining us. So reading through the announcements and listening to what the Health Secretary said yesterday, it sounds like the key focus is trying to reduce the waiting lists. Is that fair? And how many extra appointments will you be able to deliver by the end of this year?
So, tackling waiting lists is a key manifesto promise. Over 6 million people waiting for over 7.5 million appointments. It's really problematic for people. It's miserable waiting. So that is our key manifesto pledge. And what we're talking about today is the way in which we would deliver that by creating thousands more appointments, mainly in the community, but also giving patients that power to have appointments that are more convenient to them by increasing usage, particularly through the NHS app, so that they can both choose where they want to go, but a time that's convenient to them, so they don't have to do, for example, extra travel, or if they're accompanying somebody else, take time off work. So as well as the thousands more appointments in the community in these new centres, we want to make sure that people have got the power, the information when they're waiting on this list to make sure they get treated more quickly.
So how many more appointments by the end of this year?
Well, we've committed to the 2 million appointments more generally as part of our manifesto commitment, and now we're talking about thousands more appointments through the CDCs. We know that, community
The 2 million number, is that by the end of the Parliament?
Each year. So what we need to be seeing in these centres is the appointments to get people through the waiting list. We're also talking today in our plan about making sure that every appointment works. So we know that there are 8 million missed appointments through the year of people not turning up, perhaps because they didn't get information in time. We want to make sure that people have that information through to them, so they get text messages all the time. That happens in some places. It doesn't happen in others. So making sure also that every appointment is a valuable appointment. For example, there are follow-up appointments that people go along to, maybe just to check how you are as part of routine. Those aren't necessary. Those are what we call sort of low-value clinical appointments. We want to make sure we get rid of those as well. So a lot going on in terms of appointments in the system overall.
No, and I want to talk about particularly the CDCs. I think it's a really interesting topic of discussion about how you're going to deliver it. Just to round off on terms of how we're going to measure you by the end of the year on whether you've delivered or not. The 2 million extra appointments per year is for the end of the Parliament. So there isn't a statistic that we can measure you against by the end of this calendar year. It'll just be a sort of gut feel. Are people happier with the NHS service or not? There's not a target for...
We were set out, and in the plan there are a number of targets, milestones to get us through the year. The crucial target, if you like, at the end of this Parliament is to make
what about the end of this year?
That we are reducing.
What's the target for this year?
Through the CDCs, there'll be hundreds of thousands of extra appointments. Roughly. Forgive me, the exact on that extra year now. I think we're looking at up to 500,000.
OK. And let's talk about this. I mean, 500,000 is obviously a decent step of extra appointments to have by the end of the year. And talk me through these CDCs. What does it stand for, and how is it different? It does sound like a big change.
So we've got surgical hubs and diagnostic centres, and some of these are already up and running throughout the country, and people will be aware of ones that are, for example, in shopping centres that are open at more convenient times in local centres. We've got something in my city of Bristol around ophthalmology that allows you to go in to have various tests and to get treated and to have, in some places, X-rays. We'll make sure that there's something in every region, but critically, we also need to make sure that there are some of them might be different in different places because there are different demands in those areas. So some places, depending on what goes on in those local hospitals, we'll make sure that they increase the capacity in those local regions.
The CDCs, the community diagnostic centres, are going to require 7 days a week and 12 hours a day. Has that gone down smoothly, badly with NHS employees?
I think there's a real appetite amongst staff for getting these up and running and making them work, because currently, and Lord Darcy was really clear in his report on this, what staff are doing in hospitals is working inefficiently, not because of them, but because of the infrastructure they've got. They've got old kit that doesn't work. They haven't got the right up-to-date technology in the hospitals in the right places. There's a lot of workarounds, and Lord Darzi makes that very clear. These new centres dedicated to testing, to X-rays and to some surgery mean that it's clearer, they're not the busyness of hospitals, the emergencies that come through, etc., aren't happening because they're dedicated to this particular work. So actually staff find them good places to work to as well. And we want to make sure, as part of our longer term plan, the flexibility for staff is really important. People expect flexibility in their working lives. So actually some of these centres are more attractive to people to work. But obviously we need to work with employers and staff locally to make sure that the patterns and the shift patterns, etc., work for them.
Do you feel like that amongst NHS staff and doctors, nurses in particular, that there's still goodwill towards the Labour government, or do you think things like this worry them, that it's going to be more of the same?
No, I think they are up for the change. They have been working under incredible pressure before the pandemic, but also crucially through the pandemic. They know they're working inefficiently. They know they're not providing the service to patients that patients need. They know that people are ringing up more often to find out where they are on the waiting list. They're having to trying to find a way to change appointments because they can't do themselves, for example, on the app. That's something we want to change. So staff are really up for changing and working more efficiently because, of course, they do this in their normal lives. They're used to using technology for their own lives in services. So they want to make sure that the best technology is taken to patients. And they also know that in many places there's excellent practice, but it doesn't happen everywhere. Mm-hmm. So actually staff, we want to make sure we work with them, obviously, but staff and clinical and managerial leaders are up for the change. The appetite is to get rid of these waiting lists. There is nothing more miserable than coming into work in a hospital or a GP surgery, having the phones ringing off the hook, having patients waiting on trolleys or, filled up waiting rooms because they've reached the emergency stage or they haven't got the information they need to get treated. It's really demoralising.
I'm sure it is. Well, we look forward to the Prime Minister's speech at 10 a.m. and we'll, of course, have that live on Sky News. He's expected to face a broad range of questions in the press conference afterwards. And we are expecting him to push back on some of the questions that have been raised about what he did or didn't do when he was head of the CPS as relates to grooming gangs. Do you think he's got a question to even answer there, or is he going to give a resounding answer today, do you think?
Well, I don't know how he's going to do that later, but he was lauded by former Conservative Prime Ministers, by the Home Affairs Select Committee, for his work as a Director of Public Prosecutions in leading the way in tackling this evil crime and tackling those perpetrators and supporting victims. And I'm sure he will be well able to defend that record today.
And you think the result of all this will be praised rather than face questions?
He's not after praise. He's worked tackling these evil people for many, many years. He led the way in those prosecutions and supporting victims. It's not about him, it's about the victims. We know from Alexis Jay's report how prominent this crime is. I think that's shocking to people. If they haven't read her report, then I really recommend that they should. 7 years' worth of work, millions of people suffering from abuse over many, many decades, and Keir Starmer is someone who led the prosecution against those people, and we need to think about those victims.
Clearly, Reform's membership has soared in recent weeks and months. What's the view within the Labour Party, within the government, towards Nigel Farage and Reform? Is this seen as something that's actually a bigger thorn in the Conservative Party side than the Labour Party side? And Reform's sort of momentum is even something to be pleased about or not?
I think we're really focused, actually, today on delivering against waiting lists and making sure that the commitment we made to the British public and the British public's vote of confidence in us only 6 months ago, that we deliver on that promise and we'll face whoever at the next general election. Are
Reform a threat, though, to Labour?
I mean, anybody who stands against us is the threat, aren't they, in each different constituency? We're very clear about our commitment to our manifesto and getting on with that.
Karin Smyth, thanks so much for stopping by. Good to see you this morning.